The National Centre for Sport and Exercise Medicine was born out of London 2012 Olympics, and so to have a national legacy of improving population health was a really fantastic ideal.
The idea of setting up and having a centre dedicated both to elite sport but also to using the lever of the Olympics to improve the health of the population and get everybody exercising was something we really wanted to capitalise on. And so as a result of that, we started building together partnerships, and we managed to get enough traction to generate funding initially for a centre at ISCH in central London, and ultimately for the 3 centres that have formed the NCSEM between the partnership in London, the partnership in the East Midlands at Loughborough, and the partnership in Sheffield. So the clinical work at ISCH encompasses everything from elite sport through to weekend warriors, through to exercise prescription, both for those with chronic diseases and for the general population.
So here at the Institute of Sport, Exercise and Health, we have set up a specialist tendinopathy service in which we see NHS patients referred from all parts of the country, often with stubborn, difficult to manage tendinopathies. So we're characterising these patients clinically in quite some detail with a battery of physical testing, imaging, understanding their loading history. Some of the patients are obviously very active, others are quite relatively sedentary. So we've established collaborative links with other elite sports such as football, cricket, athletics, basketball and other sports that tend to suffer a fair amount with tendinopathies in order to understand the pattern of tendinopathy there better, and hopefully the findings from elite sport can then translate to benefits for our general population that we see, not just here but across the country.
So the vision for the National Centre for Sport and Exercise Medicine in Sheffield is to transform Sheffield into the most active city. And the way we're going to do that is through a 5-year plan under the banner Move More. Kind of says what it says on the tin really. We want the population to be more physically active. We have a thread of work within Move More called Activity as Medicine. And the whole point of that is to co-locate physical activity with clinical activity. And what we've done to achieve that is set up 3 centres across the city. One in the north, one in the centre and one in the south. And each of those centres has NHS clinical activity co-located with physical activity opportunities. So swimming pools, dance studios, open and green space. And what we've done is taken existing clinical activities, so musculoskeletal health, diabetes care, continence clinics, mental health clinics, and put them at the heart of a leisure environment, if you like, to make it easier for physical activity to be part of a patient's treatment, a part of a patient's prevention or recovery from illness. And then what we've done is we've combined with the universities to be able to understand, well, what's the impact of doing that? So to create the research opportunities that says, what happens if we co-locate a physiotherapy clinic with a swimming pool? Does it make it easier for people to become physically active as part of their NHS treatment?
So we started clinical services here in this fantastic new building at the National Centre for Sport and Exercise Medicine in the East Midlands. And there are 6 partners in the building. There's Nottingham University Hospitals and the University Leicester Hospitals, and the host here, Loughborough University and the Nottinghamshire Healthcare Trust. So the services that we provide here are certainly enhanced by this fantastic building. So it's a wonderful clinical setting. There's also space for us to undertake diagnostic ultrasound as part of those consultations. And right next door is the gate laboratory, so we can get people next door, see them moving, whether it be walking, running, using an exercise bike or treadmill. And of course we're juxtapositioned to the radiology services of MRI, ultrasound and DEXA scan, as well as plain film, so that's also fantastic. And the thing that we hope to develop going forward are more comprehensive services, so working with our other colleagues in other medical specialties, but also colleagues in sports science and biomechanics.
So we've recently started offering both cardiac and pulmonary rehabilitation at the National Centre for Sports and Exercise Medicine. So the exercise programme is very important for both aspects of rehabilitation, and the programme is individually prescribed for both groups of patients based on the initial assessment that we've done performing an exercise test. And throughout the rehabilitation programme, the individualised exercise programme is progressed as patients graduate through the programme. So by the end of the programme, we'd repeat the measures and expect to see a significant improvement in their cardiorespiratory fitness. And also have promoted a lifestyle change so they continue with the exercise once they've completed the course.
We also wish to provide great care, comprehensive care for people who live in the region of East Midlands, and with our colleagues in London and Sheffield develop some national services that will help provide great care for patients here, but also understand how we can improve the health of the nation. So what can we do and what part can we play in helping people lead healthier lives?